Greetings to all of you in interspace. It's Dr. Rodney, your private health detective at Co-Creative Health Solutions, with a health flash for this week. Our topic: what do you do if you get hurt at work, the gym, playing on the playfield? What are the steps to take? We're going to discuss that. Many careers involve physical labor. They're often very repetitive in motion. Same with some sports. And sometimes you get hurt. You go looking for help now for the professionals. Maybe the chiropractor, physiotherapy, massage, perhaps have to have some drugs. But many times it's the good old Dr. Time who brings out the healing. Well, just what does Dr. Time have to deal with? Well, we're going to do a little jargon right now. Everybody has their jargon, the lawyers, the carpenters, all the doctors. We have a jargon too. And when it comes down to injury, the common denominator is called nuclear transcription factor kappa B. It has to be all that convolutions, but it's all broken down chemistry-wise. It simply means inflammation factor. It's not just an inflammation of a sprained joint. Maybe you tripped and you hurt your ankle. But inflammation and these factors are also present in cancer, arthritis, autoimmune diseases, even neurological diseases such as Alzheimer's and Parkinson's all have in common the base root of inflammation. I'm sure you're hearing about this in quite a bit of the literature that comes through the mail, on the TV programs. Well, it's always the drug companies who are trying to get in on all the action. And while the development of drugs that inhibit this factor will take several years, there'll be exorbitant prices, expenses. There's already a nutritional and botanical inhibitor that we can provide with proven safety and universal affordability. The process of inflammation begins with the translation of an environmental trigger. A translation. Something is being sent into us and we're translating it. Much like you look at your world through your eyes, what you see has to go upside down back into the screen, and then it's converted. Signals are biochemical, and in a trigger with an injury, this signal could be radiation, infection, oxidative stress, fancy word for aging, food allergies, and even a vitamin D deficiency, your special sun vitamin. The trigger is a stimulus for the NF-κB cascade. Cascade in this sense meaning a pathway that amplifies the inflammatory process. It all sounds really bad, but really the body has to have a way of dealing with this, and so it has a cascade, and then it amplifies the steps necessary to take care. Once it starts, it cascades like a river to waterfall. It doesn't stop, nor does the pain stop. Our genes are encoded for inflammatory mediators, like somebody coming in and settling an argument. There are enzymes called cytokines, prostaglandins, leukotrienes, nitric oxide. This is our jargon for tonight. Other reactive species called free radicals. Think of them like bullets going off in a room, ricocheting all over the place. The process is kept inactive. So here's the good stuff. It's inactive if there is sufficient inhibitor kappa B. If kappa B inhibitor is phosphorylated, that's called destroyed, by an enemy called inhibitor kappa B kinase, the cascade commences. The injury has gone beyond the point of us being able to return it back to normal. If it is not in check, it will eventually destroy connective tissues. It can show itself in the joints with disc problems, osteoarthritis, edemas, swelling, but mainly increased pain and continuing perception of chronic pain. In the medical office, blood tests such as C-reactive protein, CRP, a sensitive serum marker of inflammation, can reveal the extent of the damage. Dietary components in nutritional products have been shown to modulate genetic expression interacting with the above nuclear factors. What did that mean? What you eat can determine how well you deal with your injury. Number one on the list, fatty acids. We all hear about this. Omega-3, 6, 9, sardines, salmon. In the old days it was castor oil and cod liver oil. Another one is vitamin D. You think about that as your sunshine vitamin and your skin and all that, but really vitamin D, because it's processed finally in the kidneys, has a tremendous effect on the adrenal glands, where we have our potent anti-inflammatory mechanisms and pain-relieving benefits. In a study, vitamin D showed itself to reduce the inflammation of CRP levels by 23%. Another area of first aid is called intensive enzymatic formulas. Chymotrypsins and such is used immediately upon the injury to break down the aberrant or the bad proteins, those CRPs, and to stop the cascade. In the stopping of the cascade, we must be sure to deal with the inhibitories, but we must allow the body's methods of healing to still occur. And the body heals in a four-step process, beginning first with the word tumor. Now don't get upset. Tumor, in this case, means delivery or products that are brought in to help are brought to the site, and the site will swell. This is the edema. The next part is rubor. So it starts with tumor, then rubor, and rubor means ruby or red. That's when the blood comes in to further help the body's process of healing. Next step is calor, and this way it's caloric, or it's energy, it's expenditure. And then finally, if all goes well, we go back to healing. If it does not go well, it goes into rigor. Rigor is death of the tissue. So that would be a sprain or an injury that is not cared for properly, and now adhesions occur, scars occur, and that joint is no longer very movable. If we look at these events and we want to provide a method to be safe when it happens, and it does happen, there's a specific set of nutrients that can start the healing phase and cooperate with the body's natural system. The emergency kit would include Biomega-3 liquid. Think of that as a delivery system for all of the good tissues that are being sent. Biodemulsion Fort. This is again the adrenal hormones situation. And then an intensive enzymatic formula which helps to deal with the proteins. Once that's taken care of, the injury is replaced and repaired by a specific nutritional called chondrosamine plus. The latest technology that's coming into the world of CAM medicine, complementary and manipulative, is the use of bioapplications, commonly known as patches if we go back into what's been seen before. However, these patches do not contain the substances. They contain the frequencies that transmit to correct the inflammatory sequence. This would be like a director being available to help all of the proper corrective procedures to take place normally. We have two specific therapies for the bioapps called TheraX Joint, and the second one is TheraX Pain Inflammation. Again, these are applied to the skin, changed every third day, and as you go through the series of events from the trauma, you now have the nutrition to repair, you have the signals to help transmit, and once that's done, you can continue using it at a maintenance dose for at least 6 weeks if the injury is a sprain. If the injury is a strain, sometimes it only takes a couple of weeks. There's a big difference between strain and sprain. Strain is the tearing or pulling or stretching of a muscle tendon, but sprain is the tearing of a ligament. And ligaments are like the strings on a bow, or the bow and arrow. If you tear that string, that bow doesn't work, and it has to be replaced. This is what our maintenance program is all about. Here are some pictures of the D, the Biomega-3. Here are the dosages now if there were to be an injury. As soon as it happens and as soon as you're able, the intensive enzymes to establish the proper sequence, you take 10 right away on an empty stomach. Don't freak out about the number 10. The intensive amount is necessary to override, guess who, that NF-kappa. If that factor continues, the cascade is going to produce more and more and more pain. This is a way to still heal, but control the pain sequence. After 3 days, the dose is lower. Just see the screen on your page here, and you'll be able to understand the dosages. Make sure this is taken on an empty stomach. We don't want any other proteins in the body and have this act on that. We want to act on the aberrant, remember that, aberrant, bad proteins, the injured proteins. This is interesting. Part of Biotics research shows that the Intenzyme Forte also is active in what are called mucopolysaccharide reactions. Just a fancy, fancy word for mucus. Now, in a car, that would be putting sugar into your gas tank and gumming everything up. If you have a flu or a cold or a sudden allergy or a respiratory response to a diesel or a perfume, the body automatically produces mucus reactions to protect it, especially in the lungs, because they don't have the ability to move themselves on their own. So lung tissues have to produce this mucus to try and protect themselves. So just as a side note, you could use Intenzyme Forte to stop a cold or stop a flu or an allergy or respiratory response at the dosage that was on that page, starting with 10 on the empty stomach and then following through as was noted. Once the problem has been dealt with, between 2 weeks and 6 weeks, depending upon strain or sprain, then to repair and replace the damaged tissues, we have a very special nutritional called Chondrosamine Plus, which contains all the necessary structures to help repair the body. And the dosage is there based upon a 150-pound body. Here's a picture of the two, Chondrosamine and Intenzyme Forte. So that's our health flash for this week. You get injured, you have your kit on hand, you're taking care of yourself, you're back at work, especially if you're self-employed, and now you're in charge of your health. Thanks for being a part of it tonight with Co-Creative Health Solutions.